Hi, I'm Jonathan Jay with Advanced Urology Institute in Naples, Florida, and what I wanted to talk to you about today is an innovative treatment for prostate cancer. But let's first start by describing what the prostate is. This is normal male anatomy, and here we have the bladder, which job is to store and expose urine. This urine is exposed into the tube called the urethra, and then this tube drains through the prostate gland. Now, the prostate gland is a male reproductive organ, and 1/3 of the fluid that one sees on ejaculation comes from the prostate, and the job of that fluid is to nourish and protect sperm until conception. So this is a male reproductive organ, and women don't have it. But the problem with the prostate, it has a propensity to develop cancer at the age of 50. And we screen for prostate cancer with two tests. One is a digital rectal examination where we place our finger within the rectum. We're able to feel the back side of the prostate for nodules. We also do a blood test called prostate-specific antigen. If the rectal examination or the PSA is abnormal, then we do an MRI. An MRI is a radiologic test to define where the prostate cancer is and if you have prostate cancer. So this is an example. If we have this white dot and it's a prostate cancer in the top part of the prostate, an MRI would show us and define this lesion within the prostate. Now, an MRI doesn't say that this lesion is a prostate cancer. It says that it has characteristics that are consistent with and could be prostate cancer. So the next step would be to do a biopsy. So we're able to do a GPS-guided biopsy through the rectum to get tissues from this area of the prostate. And if we show that this is a prostate cancer, which is significant, then we talk to you about methods of actually curing you of this prostate cancer. The two most common therapies for treating prostate cancer would be a surgery called a radical prostatectomy to remove the organ, or radiation therapy, which is a way of emitting radiation to the prostate to cause it to be destroyed without making a cut in the body. Now, the problem with these current therapies is that they damage things that are around the prostate. So we have here the bladder, we have the sphincter muscle, which closes the tube, the urethra, to provide continence. We also have nerves that traverse the side of the prostate that regulate our erections. And of course, we have the rectum on the back side of the prostate. So if you're radiating the entire prostate, any of those things could be damaged: the urethral sphincter, the urethra, the bladder, or the rectum. With radical prostatectomy, with removing the prostate, you could damage the urethral sphincter muscle, you could damage the nerves that regulate your ability to have erections. But we now have an innovative therapy called N-Cage. So whenever you have an advancement in terms of treatment of any cancer, that's surgical or a procedure, what you want to do is to gain the benefit with the least amount of trauma. So how can we destroy this lesion without damaging the things that are around the prostate? This is an innovative therapy that we have a device here. This device is deployed not with an incision, but deployed through this device here. And all we do is push this into the prostate with no incisions, and this needle is deployed on that lesion, and electricity goes through this needle to the helical part of this device and destroys any tissue within that cage. And we deploy this energy for about 2 minutes. We're able to destroy this lesion, and then we just take it out through no incisions just by twisting it like this. So essentially all we did was make a puncture site underneath the scrotum, placing a needle within that lesion to destroy it. So the patient has no catheter afterwards. The patient has really no pain other than the puncture site that we use to place that needle, and he's got cure of his therapy by destroying that tissue. So again, an innovative new treatment for prostate cancer that's minimally invasive. If you'd like to learn more about this treatment, you can contact me at Advanced Urology Institute at 239-465-4157.